Thank you, Tom, and good afternoon. As we end another week, I'm happy to report that there are now 5,317 Albertans who have recovered from COVID-19, leaving 1,073 active cases in the province. Currently, 62 people are hospitalized with COVID-19, with 9 of those admitted to ICUs. In the last 24 hours, out of 4,505 new test results, there were 58 new cases. I can also share today some early results from the asymptomatic testing in Calgary. Since testing started earlier this week, so over the course of the week since Monday, we have identified 50 COVID cases who are reported as having no symptoms. It is important to note, first of all, that I do not have information on how many of these are asymptomatic close contacts of confirmed cases and how many have no known exposure. Secondly, it is important to know that we do not yet have the full investigation on all these cases. We know from other jurisdictions who have done asymptomatic testing that sometimes on further reflection, those who initially report no symptoms do identify mild symptoms that they may have had earlier. I will have more information to share next week, but it seems from this early information that the asymptomatic testing program in Calgary is helping us identify additional cases. As we do further evaluation on possible locations of exposure, I will share more information. I am sad to report 4 additional deaths in Calgary zone. All were in continuing care facilities. This brings the total number of deaths in Alberta to 125. Even while we begin to enter stage 1 of our relaunch, let us remember this virus still poses a risk, particularly to the elderly and people with chronic medical conditions. We need to remember that no Albertan is expendable and their lives matter as much as any of ours, and to keep the grieving family and friends of those who we have lost to COVID-19 in our thoughts. In this stage, we need to be mindful of continuing to minimize infection risk. One way of helping businesses and locations that are reopening to apply guidance to their location is through a template that we have posted on our relaunch webpage. For businesses or locations that are newly opening, we have extended the time frame to complete that template from 7 to 14 days after they open. I also want to clarify that for those locations that have remained open throughout the last few months, completion of this template is voluntary. For those that wish to complete this and post it, it can serve as an additional reassurance to employees and patrons of all the ways that they are being protected from the spread of infection. As we head into the long weekend, I know many of us are turning our thoughts to the outdoors. Alberta's relaunch strategy recognizes the importance of the outdoors and recreation for Albertans' sense of well-being, while also recommending limiting non-essential travel outside the province at this time. With that in mind, I am pleased to announce that effective today, outdoor gathering limits are being increased to a maximum of 50 people, no matter where you live, as long as physical distancing of at least 2 meters is being maintained between different households. And everyone attending that gathering follows proper hygiene practices. I also encourage you not to share food or drinks at any of these gatherings, as this practice has frequently been linked to transmission of the virus. As we start to ease certain restrictions, it is increasingly important that we all continue to take proper precautions to prevent the spread of COVID-19, including frequent hand washing, always staying home whenever you feel ill, and considering use of a non-medical mask while out in public, particularly if you will be within 2 meters of others. We must also use our best judgment when determining whether a gathering can go ahead. For example, if you are planning a gathering of friends in your backyard, only invite as many people as your yard can hold while maintaining 2 meters of physical distance between people from different households, and encourage people to bring their own snacks and drinks and to not share these items. You may also want to clean and sanitize doorknobs, faucets, and bathroom facilities partway through the gathering if people from outside your household are using them, and have hand sanitizer available to your guests. Hold off on any gathering if you are uncertain you can follow public health orders and guidelines. Again, this new order permitting gatherings of less than 50 people applies only to outdoor gatherings. Indoor gatherings, not specified by the measures I spoke about earlier this week, must still be limited to fewer than 15 people. For those who are looking to get away to a summer cottage this weekend, respect the health and safety of small communities along the way by planning your trip without stops for gas or food where possible. We should continue to avoid non-essential travel outside the province. When outdoors or in public, we must take all necessary precautions to protect our health and the health of those around us. Some municipalities continue to restrict access to playgrounds. Please follow these restrictions where they apply. Where playgrounds are not municipally restricted, they can be accessed. I recommend encouraging your children to play with children in the same household or cohort family. Also sanitize hands before and after playing on a play structure, and remember to wash your children's hands and your own thoroughly when you get home from the playground. Please download the AB Trace Together app and turn it on both when you leave your home and when inviting people to come to your home. This app currently has almost 172,000 users, and the more people who use it, the more effective our contact tracing ability will be. I know we are all noticing how different this May-long weekend looks, and one group in particular is the graduating class of 2020. Graduating is a major milestone and an achievement worth celebrating. This year's graduates have found creative ways to adapt to the new realities while working hard to complete their studies. That ingenuity, flexibility, and forward thinking will serve you well as you continue on to further studies or your chosen career. And as you look for unconventional ways to safely celebrate your achievements during this year's unique grad season. Congratulations to all graduates of the class of 2020. I wish all Albertans an enjoyable long weekend and hope you can take a break to have some fun. It's well deserved after so many long and difficult weeks. Stay socially connected, but do so as safely and responsibly as possible. I will be enjoying some time with my own family this weekend, and like previous weekends, we will not be holding media availabilities. And after the long weekend, I will start to provide my updates on a reduced schedule. The pandemic is far from over. However, in consideration of the reduced number of cases overall and the fact that we have begun to resume operations under Stage 1 of Alberta's relaunch strategy, I made the recommendation to scale down the frequency of my availabilities. I am privileged to have the opportunity to speak with all Albertans every day, and I know many have become accustomed to these daily updates. I assure you I remain committed to transparency, and while the number of availabilities may decrease, I will continue to provide the information you rely on. Next week, updates will be held on Tuesday and Thursday. The following week, we will schedule availabilities on Monday, Wednesday, and Friday. Should there be an event of significance, we will be sure to schedule an availability to share information with Albertans. Case information will continue to be posted online daily. Thank you, and I'm happy to take any questions.
All right, we'll now go to the phone. In addition to Dr. Hinshaw, we also have Dr. Mark Jaffe, Vice President and Medical Director with AHS, available for questions. Operator, could you put through the first one, please?
This first question is Michael King with Global TV. Go ahead, Michael.
Hi there, Dr. Hinshaw. Hopefully my phone's working this time.
It is.
I had a quick question regarding the asymptomatic testing. How many tests in total have been done that garnered the 50 results? And then on the new change to outdoor gatherings, why 50? Why was that chosen? And what kind of numbers suggested that we're able to have these gatherings now?
Sure. So on the first question, the total number is about 1,500, and we do have a batch of tests that the team is still working through to determine if the people who came in were symptomatic or asymptomatic, and so sometimes that's not recorded right on the form. So working through some of that still, but that there was just over 1,500 people in the group that were recorded as being asymptomatic, although again, there's still some follow-up work to be done to determine exactly what the circumstances were. With respect to the number of 50 in outdoor gatherings, so we've been hearing lots of feedback from Albertans, and we've been having conversations about how we can make sure that we're balancing both the need to protect Albertans from the spread of the virus, along with the need to make sure that Albertans have the supports that they need for health in all aspects of their lives. We know that outdoor recreation and being outside in well-ventilated open spaces, that there can be less of a risk in those contexts as long as people are following the guidelines. And so what we did is looked to align, we have allowed for some expansion of some other activities such as indoor worship gatherings, and we've set a limit of 50 on there. We've looked to neighbours such as BC, where there's a limit of 50 that they've maintained throughout the course of the pandemic. And we've looked at international examples to see where that number we could align with. And so again, that number of 50 is what we've chosen. It's also the number that we had used prior to reducing down to 15. So again, we want to make sure that it's clear that this is outdoor gatherings where that risk is lower, and that all public health requirements do still apply with those gatherings of 50. But we wanted to, again, take the feedback from Albertans and make sure that we're balancing those two important aspects of our response: protection from COVID and support for the overall health of all Albertans.
Operator, could you patch to the next question, please?
Next is Rafi Butukanian with CBC. Go ahead, Rafi.
Thank you. Hi, Dr. Hinshaw. Just wondering, as we start easing some of these restrictions and relaunching Alberta's economy, how much concern do you have that, some people will try to push some of these liberties, say instead of 50, they'll try to be 75 at outdoor gatherings, or, they won't necessarily respect the 2-meter physical distancing stuff? And given any extra concerns you may have, do you think there should be extra enforcement of these orders?
So I know that there's a spectrum of perspectives in Albertans, just like everywhere else around the world. And what I would say is that I think that the majority of Albertans understand that the rules that are in place are rules that help all of us understand how we can best protect each other and ourselves, so that these rules are meant to be a support to Albertans and to help us all understand what are those limits that we're currently testing. We're currently evaluating to see what our ability is to maintain the limited spread of infection even as we start to open up. And so I guess what I would say is that the better that we can collectively hold our infection rates stable and low as we move into this stage 1, the quicker we'll be able to move to stage 2. And I think most Albertans are interested in protecting themselves, protecting their loved ones, protecting their neighbors, and that these are the things that we can do together to make that happen the most effectively and to help us all get into stage 2 as quickly as possible. And I think I've said before that I think the more that we are punitive, take a punitive approach and a shame-based approach to people who have infection or who are close contacts, the more that will drive things underground. And so what I would really encourage is a compassionate and kind approach to, again, support each other, to support our neighbors, support our families, to do the right thing, to protect, again, ourselves, to protect each other. And again, I think most Albertans understand that we're all in this together and that we can only get through this by working together.
Operator, could you put through the next question, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. I'm hoping you can clarify some of the rules around cohort families. For one, how many different families can be part of one cohort unit, and is there a legal limit to the amount of people who can be part of a cohort family? As well, can you be part of a cohort family if you're still going into a workplace every day while other members of your cohort are not?
Good questions, and we've had a lot of requests for clarifying the cohort family concept. The way that we've set this out is not as a legal entity. So rather, what we're wanting to do is to provide Albertans with a framework for how they can safely set out a small number of people with whom they can have gatherings where they don't necessarily need to be following that 2-meter rule. And so at the moment, we are recommending that it be a family or household with one other family or household, and that that it's possible if you have those 2 cohort families, that say the adult members of the families could be working outside the home. That doesn't preclude you from having that cohort family connection. But I think really it's up to each Albertan family, and again, want to be sure that single Albertans who are living alone, that they can absolutely then connect with another household as a part of their cohort. And that there's also, I think, a need to be realistic in terms of people's real life situations. So there are situations of shared custody, there are situations where households are connected together through perhaps caregiving responsibilities or duties. And so really each family is going to have to look at their particular situation, how many members of their household may be at high risk for complications, and what kind of risk they feel comfortable in accepting in order to have that relationship with another cohort family. So we're providing it as a construct, again, as a support for people to be able to think about having someone outside their own household that they can spend time with and not have to worry about that 2-meter distancing. But it's also, again, not a legal entity, and each Albertan family is going to have to be thinking through what kinds of risks they're comfortable with and how they're going to be structuring that cohort family relationship if they wish to have one, and with whom.
Operator, could you put through the next question, please? Operator, did we lose you?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Thanks for taking my question. How did the R value of the virus factor into the province's relaunch strategy? Should we have waited until we were below 1, or is the R value lower when you factor out outbreaks in continuing care centers and the meatpacking plants? And in regards to the asymptomatic testing in Calgary, at what point could that be expanded to across the province?
So the R value is a part of the context. So there are 2 main triggers in terms of considering when we move from one stage to another in our relaunch. And the 2 triggers that absolutely must be met, one is that we must have hospitalization rates related to COVID that are stable, declining, or have increased by no more than 5% in the preceding 2 weeks. The other absolute trigger that must be met is we must have ICU admissions of below 50%. But because those 2 triggers are lagging indicators that take 2 to 3 weeks to change between when an exposure happens and when those numbers would be affected, we also need to have contextual indicators. And the contextual indicators that we use are things like the reproductive number, which early this week was at 1.2, as well as the number of new cases in particular areas and across the province, and the number of new cases that have no known source, so where we're not sure where that case came from. And so for those contextual indicators, we don't have a hard and fast trigger as we do with those 2 earlier indicators I mentioned, but they are more factors that help us to determine, are we seeing increasing numbers of cases? Are we seeing, again, the R value of greater than 1, which indicates there's still some growth? Are we seeing many cases where we don't know where they came from, again, indicating there's wider spread in the community than we're detecting? And so those are all of the pieces that go into making that decision. And again, the R value is one of those contextual factors. And so I think it's difficult to say exactly what that R value cutoff is. Again, we would want to keep it at 1 or less, but didn't feel that across the province that the 1.2 was sufficient to require a delay in moving into stage 1. However, seeing the number of new cases in Calgary and some of the ongoing spread there, again, as well as Brooks, those were those 3 contextual indicators that really influenced our decision making. The question about the making testing available to everyone across the province, we're seeing very low numbers in other places besides Calgary. And it's really important to remember with testing someone who has no symptoms at all, If that person has no known exposure to the virus, then it's much higher likelihood if they test positive that that is a false positive test. And so we know that when we test someone who has no symptoms, the biggest value we get from that test is if that person had a known exposure, if that's in an outbreak setting, or if that person is a close contact of a confirmed case. And that testing is available across the province. So anyone across the province who is in an outbreak setting or who has been in contact with a confirmed case, even if they have no symptoms, is absolutely eligible for testing. And those people can go online, fill out the online AHS form, and register for testing. Testing broadly in the community outside of an area where we have high rates, like we do in Calgary, is not our highest priority. Again, we really want to focus our testing where we get the most clinical value. And so the broad-based testing across the province is unlikely to yield a lot of good clinical information. We are looking at population surveys, and some more information will be coming on that to be able to do more of a provincial sampling program. But to do the broad-based testing that we're doing in Calgary, that's really being driven by the fact that Calgary has higher rates than other parts of the province.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please? Operator, are you there?
Yes, can you hear me now?
Yes, we can.
Okay, it's Jason Herring with the Calgary Herald. Go ahead, Jason.
Hello, Dr. Hinshaw. It's been weeks now since the last new case was confirmed at Mackenzie Town Continuing Care Center. With that outbreak hopefully close to wrapping up, I'm wondering if you had any reflections on how that outbreak was handled and what it taught you and other public health officials about how to respond to these outbreaks in long-term care.
So Mackenzie Town certainly was the first large continuing care outbreak that happened in our province, and clearly was one that had a huge impact on all residents, staff, and families of those who live there. And again, want to express my condolences to all of those people, because there's been a huge amount of loss at that location. I think that one of the important things that Mackenzie Town illustrated was the fact that when people in a continuing care centre are exposed to the virus, they sometimes have symptoms that aren't typical of what a younger person would have. So we did see people who had relatively mild symptoms early on, and also in that group of people that there were definitely cases where people had relatively mild symptoms, didn't appear very ill, and then suddenly became very sick, and in the most tragic cases, passed away, again, within a matter of days. And so I think a few things that became very apparent, one was that having staff members move between facilities, working at multiple different facilities, was a problem and a challenge where we could see introductions of virus from one facility on outbreak into another, despite, again, the best intentions of those staff members. So that was part of the reason that we did implement the 1 staff per site rule. And again, that wasn't just Mackenzie Town. We certainly saw examples in other provinces like BC where they identified a similar issue in their continuing care setting. Also, the importance of early and aggressive reporting. And so we did set up a province-wide 1844 number for all continuing care sites when they identify even one case with even mild symptoms. So the importance of prompt identification and a consistent way for all of those sites to be able to get help and support. So there certainly are many of the supports that we put in place, the orders that we have specific to long-term care facilities, that have been informed by lessons learned from that and other outbreaks. We do continue every time we see an opportunity to improve. We are continuing to make refinements to those orders with the input of operators. And again, want to thank all of those who work in the continuing care sector for all the work they do to keep the residents of those places safe.
Operator, could you put through the next question, please?
James Keller with the Globe and Mail. Go ahead, James.
Hi there. We're hearing from communities near the Alberta-BC boundary that they're still seeing out-of-province travelers. What's your message to people on both sides of that boundary who are considering traveling over it? And do you think Alberta or BC need to put some teeth behind the recommendation to avoid that kind of travel?
So my recommendation continues to be to avoid out-of-province travel. There are certain things that have been in place to try to reduce some of that, such as, for example, provincial parks only taking reservations from Alberta residents and not from people who live in other provinces. I know that some Albertans have summer homes in BC and potentially vice versa. But I would ask Albertans and those in BC or Saskatchewan who are considering traveling for the long weekend to reconsider. We have said that traveling to summer homes within the province at this point, as long as traveling is happening, you can stock up on groceries and gas before you leave and then go to that summer home, that's okay. But we are asking people to not cross provincial boundaries as a way of limiting spread of the virus. With respect to whether or not we should be putting some teeth behind that, at this point, I don't think we're there yet. We do have regular conversations with our colleagues. I have conversations with my colleagues in BC and in Saskatchewan. And at this point, we're not seeing a need to recommend further enforcement measures. But again, continue to encourage Albertans to do the right thing, to stay within the province and to make other choices with respect to how they spend their long weekend.
Operator, could you put through our final question, please?
Final question is Lisa Johnson with Post Media.
Hi, Dr. Hinshaw. Thanks for taking my question. I was wondering if you could comment a little bit on the long weekend. Hi, can you hear me?
I can now.
Hi, sorry. I'm wondering if you can comment on the long weekend. It looks like we're going to have really nice weather, and with some of these recommendations kind of easing up in terms of large gatherings, what kind of advice do you have for Albertans who want to go camping, particularly in places where facilities still won't be open to them? And do you see this long weekend as a bit of a litmus test for easing a lot of these restrictions up?
So there are campgrounds that are open, so municipal and private campgrounds who choose to open can do so, making sure that they are putting measures in place to ensure that there's limited opportunities for the virus to spread. But really, the choices that Albertans make, I think we, again, need to collectively be thinking about how this weekend sets the tone for going forward. And Albertans who are thinking about going camping, spending time outdoors with doing different kinds of recreation, absolutely should be planning those things. I think that we need to be celebrating the accomplishments that we've achieved, and the best way to celebrate the accomplishments that we've achieved together is by continuing to be thinking, even as we move to the outdoors, potentially, again, whether it's going camping, going to the park, that we continue to think about what we need to do to prevent the spread. So if those who are going camping, thinking about who they're going camping with members of their own household, potentially with a cohort family, wanting to encourage people to, again, if they are gathering in groups outside, keeping that 2 meters distant from each other, not sharing food or drink, so people can bring their own beverages, their own food to gatherings. Because I think you're right, this is a bit of a litmus test, and we'll be able to see in 1 to 2 weeks' time after the long weekend how this long weekend impacted the spread of the virus. And it's still with us. It hasn't gone away. And so again, just really encourage all Albertans to remember that we need to stay in this together. And the more that we can reinforce that with each other, and the more that we can support each other to make those right decisions, the quicker we'll be able to move into stage 1 and continue on with our relaunch.
Thank you for joining us, everyone.
Stage 2. Move to stage 2. Sorry.
Thank you for joining us, everyone. We will provide another update on Tuesday afternoon. Have a safe weekend.